call on the Minister Jennifer Carroll McNeill to make her statement.
Thank you, Lascia and Corla, and I thank the House for the opportunity to discuss this really most important issue to all of us. Just at the outset, on a technical piece, I think it's important that I clarify just a technical piece in relation to protected disclosures and how that works, because I am conscious that it was the subject of debate among the leaders last week, which I totally understand, but it's important that the House have clarity in relation to that. The Protected Disclosures Act was agreed by this House without a vote. Everybody supports the idea of it, and the purpose of it is to protect whistleblowers. It creates an obligation on the Minister to establish a channel on their website and an email process for whistleblowers to be able to make disclosures. That exists in the Department of Health. There is on the website, and it's very clear that this is a channel to reach the Protected Disclosures Commissioner. It's a separate, dedicated, secure mailbox, one that I do not see, that I do not have access to, nor do my private secretaries. And the purpose of maintaining that separation is exclusively for the protection of whistleblowers. I know that it was sort of mentioned that this had a lack of curiosity on my part, but I would say to the House that were I or any other minister to start checking what was coming into the Protected Disclosures mailbox, it would create a completely new, different problem for whistleblowers and sorts of undermines the idea of there being a protected channel specifically for that. So it's really just, I know the House is already aware of that because of their support for the Act, but it's just to put beyond doubt the need to protect whistleblowers and the reason for those steps, and that it is not in fact something that comes to a minister's desk, nor should it come to a minister's desk. It should be investigated separately and appropriately. And if we had a minister like me or anybody else who was interfering in a curious sort of way into what was in the mailbox, well, I think that would raise important confidence issues in that minister, and I just think it's important to be clear in relation to that. And I thank the House for indulging me in that way. Much more importantly, on the question of paediatric spinal surgery waiting lists, which is the subject of our discussion today, I want to thank all of the members of the House who have engaged with me on this in the last number of months since I became Minister for Health, and I have tried to place a significant and systemic focus on productivity generally in our hospitals, but in this most acute area of need in relation to spinal services, paediatric spinal services. And all of us do this because we are concerned about the children whom this impacts. We are concerned about their quality of life. We are concerned about the nature of the supports and interventions that they get and the necessity for those to be timely. In particular, I want to thank all of the patients, the families and the advocacy groups that I've spoken to at different times throughout this year. Because while we speak about numbers and initiatives and reforms, what we are speaking about, of course, is children, patients, many of whom have quite complex medical conditions, a multiplicity of medical conditions, and who need very great care. I do want to assure patients and families that I have heard what they say to me and that their perspective is vital in ensuring the reforms that we know must be ongoing to ensure better timely care. May I also say to members of this House that I, like them, are the recipient of people coming to me with particularly complex cases where there is a sense that intervention is necessary now, that intervention has been too late, that there is a difficulty with communication. And in my case as Minister, I can take those cases up with the National Patient Safety Office and have them advanced. And I know that has been the case with some people who have come to me and brought cases to me. Can I just say to deputies, there is an open invitation at my door to anybody who wants or needs to bring a case to my attention. I have tried to, and I will be meeting CHI for deputies. I appreciate we do all this scheduling in a particular way. It's not perfect, but tomorrow I am meeting CHI on two issues. One is the Children's Hospital, and the second is yet another meeting in relation to what is happening on spinal services and what has happened since our last meeting. But one of the things that I will want to see most closely is the children who I believe to, or who are at the level of most complexity in the system, and what is the specific care plan for all of those children. Now, there's certain GDPR constraints to the information that can be shared with me, but I have several cases on my desk, as I know other deputies have, and what I am saying is there is a real openness here to get to understanding that the most complex children are getting the care that they need, the intervention that they need in a timely way and in an appropriate way. And I just want to say that as a general opening statement and invitation to all. Excuse me. So, as we know, scoliosis affects about 1% of children and adolescents in Ireland. Many of those children don't in fact require surgery, but for those who do, timely access to intervention and treatment is critical. For those children who need surgical intervention, we agree that the waiting times are too long, and I am acutely aware of the burden that long waits places on those young patients, and that it can make their situation very much more difficult. Improving access to spinal surgery has been the focus of sustained and determined efforts over several years by several Ministers for Health, and we have not fully reached our goals. I do want to acknowledge that the efforts that have been put in so far have yielded tangible progress, and I also want to acknowledge the dedication of the nursing team, the healthcare professionals, the multidisciplinary teams, and indeed the surgeons who are delivering better outcomes than we have had before. But we are, in this House, are dealing with patients on a day-to-day basis, and we know that we need to do further and to do better. There has been a significant focus on investment for those services. There has been new infrastructure. We have a 5th Temple Theatre in Temple Street, an additional MRI scanner in Crumlin, 24 additional new beds in 2024. My predecessor ensured that there was 52 new full-time equivalent posts approved to strengthen services, including surgeons, nursing staff, administrators, all of the different pieces of that, including 4 orthopaedic surgeons, one of which is in post since August of this year. And of course, we would like to recruit all 4. I have only been able to recruit 1 to date. 41 of the 52 staff are in post, and we are actively trying to recruit for the rest, especially at consultant level. I think it's important to say that we've tried to increase capacity in a range of different ways, both domestically within CHI and a number of different and internationally. And let me just address some of the complexities of the issues there that I have seen as Minister. For example, in 2024 we agreed with the Mater that they would do an enhanced transitional service, adding to the transitional services that were already in place, and indeed they were funded to do so. An additional 29.5 posts were approved for the Mater Hospital to enhance the adolescent transition spinal service and try to improve the seamlessness with which transitional care would occur. It was only at the beginning, in the second half of 2025, that service began to operate, which I think is deeply regrettable. I do know from my engagement with patients and parents that the service is in fact operating, and that there have been, I think, 4 outpatient clinics to date in the Mater in the second half of 2025, and I think 3 surgeries scheduled. But I believe that it is problematic and regrettable that that intervention and step that my predecessor took in 2024, for which posts were allocated and funded, in fact only began in 2025. It is now the case that those posts are all in recruitment because the service has begun, and there's been a commitment by the Mater for that to begin, and those posts should all be fully in place in the first quarter of 2026. On the international outsourcing, again, my predecessor approved over €16 million for international outsourcing initiatives since 2024. And of course, we know that that was designed to support earlier surgery for children with very complex cases, and to get the care that they needed abroad as clinically appropriate. However, it is a source of great frustration to me that a total of only 19 children have been the beneficiary of that. It is a source of frustration to me that it is not higher, and I think it is a source of frustration to families who would like to travel, who either have not been offered the opportunity to travel or who believe that they would have been suitable. Of course, I do acknowledge that not every child is suitable for travel. There may be for whom it isn't suitable or cannot travel, and there is a tension here where I believe more should be done, and there is a clinical element to those decisions, and it's not appropriate for me as Minister to interfere with that on an individual clinical basis. And yet, when I look at the system, what I see is 1,000 surgeries, essentially 500, last year, essentially 500 this year, slightly more than that, for children who have needed surgery. And in that period, 2024-2025, where the international outsourcing option was available, only 19 of that 1,000 has been done internationally. And from a systemic perspective, that doesn't ring true to me. And so, can I say that that has been the case to date? But we are trying to expand our international options to drive even further the opportunities to travel, both in Europe and in additional surgeries in the United States. Obviously, at the moment, we have the New York Presbytery Hospital and we have Great Ormond Street, but there has been a tender process that CHI have gone through in the last number of months at our direction, at the direction of the Department of Health and my direction, to try to expand opportunities internationally. And that is being finalised shortly, and I believe it will involve multiple additional hospitals. But I suppose the point that I'm making to the House is that if the experience to date has been that there has been an international option but not available to patients at the rate that might be suggested at 19 out of 1,000, then it is essential that if we're providing additional international options, that there is a very clear understanding that those options should and can and should be used. And I think that's extremely important. From an operational level within CHI, the Paediatric Spinal Surgery Management Unit was established last year. It's a dedicated unit to try to coordinate better surgeries across Temple Street, Crumlin and Kappa, and it is working more closely with multidisciplinary teams to do that. And efforts to expand capacity within CHI progress, and indeed will be the subject of my dialogue with them tomorrow, including ring-fenced theatres, dedicated orthopaedic beds. And to be fair, that implementation has in fact reduced the waiting times for spinal surgeries. There have also been, in general, additional outpatient clinics which have begun to assess new patients more promptly, and that is both necessary and helpful. Since April 2024, over 800 new patients have been seen in those clinics, and that has reduced the time to be seen by a consultant, in addition to the dedicated referral pathways. There have also been domestic outsourcing arrangements that have been expanded using for non-complex spinal procedures, pathways to Blackrock and Kappa more quickly. Over 74 children this year have used those pathways since the beginning of this year. And as I said, we try to expand the international option. There have been these initiatives and investment. While I express a measure of frustration with the pace and wanting to do more, I do need to acknowledge to all of the dedicated team, the nurses, the whole team, the anaesthetists and so on, and the surgeons who are doing work, that there are surgeries happening. We know children who are getting surgery, and that is certainly an increasing rate. There has been, so this year, in 2024, CHI had 513 spinal procedures. That was a 10% increase on 2023, a 35% increase on 2019. Already in 2025, 446 children have had procedures, 446 procedures have been completed, which is an 8% increase on last year. So there is growth, there is more activity. But it's also, I have to say, at this year, there has been an 8% increase in referrals this year, and we are at the present time, at this moment, 7% behind target. So there's a picture yet to improve, but there's also increased referrals. What matters most, of course, is the length of time that children are waiting on the procedure, and there has been an improvement in longest waiters. At the end of October, yet to improve, but there's also increased referrals. What matters most, of course, is the length of time that children are waiting on the procedure, and there has been an improvement in longest waiters. At the end of October, 68% of patients on the active list were waiting less than 6 months, which is an improvement to last year, which was 56%. And further, at the end of October, only 6% of patients were waiting only 12 months, which again is an improvement on 16% at this time last year. And again, at the end of October, 38% of patients were waiting within the Sláinte Care targets, though I would like that to be substantially increased. So what I'm trying to say is I will stand here and acknowledge all of the difficulties and challenges and frustrations that I have. I will also acknowledge the progress that has been made and that we want to see continue to improve. I am also seeing improvements in the outpatient list. The children without an appointment to date on the new outpatient waiting list has reduced by 48% since the start of the year. Currently, there is no child, I'm informed by CHI, waiting over 9 months without an appointment for a new outpatient appointment, and that improvement is ensuring children are seen more quickly. But we cannot let these, while we must acknowledge progress, absolutely, we also can't mask the ongoing reality that too many children are still waiting, and that too many complex children are still waiting. Up to the end of October this year, there has been an additional 462 or 8% children, 462 children have been added to the active surgical waiting list. It does reflect a growing need. It also reflects a better referral pathway, but it is still children who need spinal surgeries. And there is also a shift in the complexity of cases presenting at CHI, because now non-complex cases are essentially being referred to other hospitals to be done more quickly, and that is in itself a good thing. But the complex children who may need several procedures and who may need very significant multidisciplinary support, that is something that I am concerned in relation to. I'm also concerned about the communication, and that is something that families have repeatedly expressed to deputies across this House as being something that is very challenging for them. I have made it clear that communications, the nature, the style and the promptness of communications has to change. The way in which families are discussing surgeries, surgical interventions and the overall plan for their child is everybody's responsibility, and it is not to be approached in a siloed way. it is difficult for us to build a new theatre, to recruit a new surgeon, to be fair, but it is not difficult to pick up the phone, to talk to somebody properly and in a comprehensive and timely way about the needs of their child. And these are things that can be done, and I have said this in the House before. Now, I have, to support improvement, we have appointed a spinal patient advocate liaison coordinator, and there's a patient panel for spinal services to try to improve communication. There are 14 members on that panel at the moment, and a key worker or patient navigator function is also being rolled out. So what I'm saying to deputies is that there have been efforts made to try to improve communication, though I understand from parents that the benefit of this is not yet universal. There are steps being taken and we have more work to do on it, essentially, is what I'm trying to say in a truncated way to make all of the points that I hope to make. May I address some of the different reviews and issues that are occurring more broadly in CHI historically? And of course what we want is to have a future-looking system where everybody has confidence in the system, and the difficulty with the issues of the past is that they must be addressed, that there must be transparency, and it's very, very important to acknowledge while we try to look to the future and try to improve services, we also have to hear and understand the experience of the past and indeed difficult experience of the current day. In April, I stood in this House and we discussed the HICWA review on the governance of implantable medical devices in CHI, including the use of non-CE springs in Temple Street. A month later, we were here to discuss the Thomas Independent External Medical Audit for Children's Health Ireland and the pelvic osteotomy. And at an early stage, that early stage in April, I had a very, very clear concern about the culture about orthopaedic services, as I know deputies across the House have had, and the way in which waiting lists have been managed to date and how that has operated. A month later, we had the 2022 report, the unpublished report, and the NIGAM review is also underway, phase 2 of which is reviewing the service, including the governance. So there's a series of different reports, and I'm conscious that behind every one of those reports there is a patient, there is a child. But I think what I'm trying to say to deputies is, in response to the multiplicity of reports, in response to the concern I have in relation to culture and in terms of waiting list management, I commissioned an audit, the details of which we have not yet received, and I think it's really important that we debate that when we do receive it. It has two elements. So I commissioned this via the CEO of the HSE, an audit of governance and equity in patient access and waiting list management, and that commenced in June. The audit is being undertaken by the HSE internal auditor. It is independent. I'm told it's nearing completion. I expect the outcome shortly. Importantly, and this is really important, I at the time as well asked for there to be a qualitative patient experience element to this. And I asked that Lily Collison, who is an advocate for spinal services, cerebral palsy and epilepsy and many other things, and is a member of the HSE board, that she would complete that. And so she has been in CHI on those past number of months doing a survey of parents, speaking to parents who wish to speak to her and trying to better understand the patient experience. How did you end up on this waiting list? What is your experience? How have, what has happened to date? And I expect her report shortly. I didn't publicise her name at an early stage because I wanted to give her the opportunity to get on with her work in a quiet and effective way, and to give her the privacy to do that. But I think it's very important to say we did both of those things at that time, and I expect to have that report very shortly. As well, I won't address the spinal task force, which continues to work just out of a question of time, but I do want to talk about the inquiry that the Cabinet agreed to yesterday. And it is our intention to have a statutory public inquiry into the care generally received of children with scoliosis, complex scoliosis, spina bifida, hydrocephalus, and the care issues around that. It's really important now that I become really extremely careful with what I say about the detail of that, because I'm conscious that we want us to establish a process that is legally robust, that has very clear terms of reference. We have asked, and the parents and the advocacy groups, indeed the breadth of stakeholders, including the advocacy groups that are on the spinal task force, for example, all of them to engage with a facilitator, the attorney who will help listen to understand the best scope and help develop a proposal to me so that I can properly draft terms of reference and have those agreed by government. It's the intention to do that with families in the most appropriate way, recognising that it is, of course, government and the Oireachtas that has to ultimately sign off on them. The Attorney General is already engaging with potential people, potential names, senior councils and so on, to determine who may have availability to do this work and to get that going as quickly as possible. Of course, the calibre and the quality and the experience of somebody who we want to do this work isn't always immediately available tomorrow. They have schedules and commitments already, so we are trying to do the best to get somebody as quickly as possible, but also who is as capable as possible as doing that. I'm very conscious that my colleague is going to speak, and I don't wish to speak across her. So I can address any questions that deputies have perhaps in my concluding remarks, because I'm conscious there will be a lot of interest in that. And of course we are continuing with the journey in relation to the integration of CHI into HSE. I'm not sure that I've had the opportunity to formally update the House in relation to the board members that have been appointed, the chair being confirmed by Cabinet there I think last week, and that is work that is ongoing, and that we will need to now prioritise the legislative element of that and bring that to the House, I hope in 2026, to begin the process of making that transfer more formal. But I do wish to give my colleague the opportunity to speak, so thank you.
Minister.